So, it was brought to my attention a question on the quiz about the hock joint. And so the original question that had been on the quiz was, what's the anatomical name for the hock joint? And it was, now that I think about it, it's kind of a poorly worded question because the hock joint is made up of lots of bones, right? So you have the tibia, and then you have the tarsal bones, but you also have the metatarsal bones. And so a more appropriate question would have been, the hock joint includes the tibial tarsal joint and the tarso-metatarsal joint. And so it's not that you guys got it wrong, I just inappropriately kind of worded the question so that you gave me the wrong answer that wasn't what I was looking for. So what I'm going to do is just give everybody an extra point. Okay, so regardless of whether you got it wrong or not, I'll just give you guys an extra point. Okay, so when you're doing the dissection today, I want you to choose a systematic approach just like you did with the forelimb. I prefer to start on the medial aspect. So I chose the leg with the more dissected, or excuse me, the more prominent vessels. But this is what it would look like before you get started. Do you notice that there's a lot of fascia right through here? Okay. What I want you to do is just like you did with the cephalic vessel, I want you to isolate out the vessels. And there's actually a nerve in here too, right here. Okay? So that you can separate it away from the muscle. And the best way to do that is take some tweezers, kind of pull up, and then take a pair of sharp scissors and just literally cut along each side. Okay? And then that's going to reveal the superficial muscles that you see here. The one that's most cranial is right here, and that's called the sartorius muscle. So it's the cranial medial muscle. Okay, sartorius. And then the caudal muscle is called the gracilis. And just like last week's list, you saw that I had separated into superficial and deep muscles, and you're going to need to ID the superficial muscles before you can find the deep ones. So what I've done is I pull on the leg and I pull back the fascia and the fat, and then the gracilis kind of starts to come up on its own from the cranial side. And from the caudal side, where it's medial, you just have to use scissors or a blade and cut through here. Cut all the way around because you need to reflect it completely back. Okay, because you're not going to see the deeper muscles unless the sartorius is reflected back. The other muscle that needs to be reflected back is that other superficial muscle. So here's the medial border of it. Here's the caudal border of it, and it's actually bordering a big fat pad right here. And ideally, if you haven't already done so, I want you to destroy this. It's the only piece of fat I want you to preserve because it has the popliteal lymph node inside of it, which I'm going to be able to ID. Okay, it's a popliteal lymph node. If you did, that's okay. Take a picture of mine. So here's gracilis, and I did the same thing once again, and I reflected it back. Okay. So sartorius is more cranial, gracilis is more caudal. Next thing I want you to do is look at this really thick piece of white fascia here. Do you see this large piece of fascia? You don't want to get rid of the thick part. Now this is just fat over the top. It comes off very easily. But this is a very dense piece of fascia that has a name. It's called the fascia lata. Do you see this here? What I had to do is I had to cut it away from the muscle that it's lying to medially, and then the muscle that is going to be cranial. Okay, so you can see that. I cut it away here on one side, cranially, and then caudally on the other side. Fascia lata. The muscle attached to it is called the tensor fascia lata muscle. So that should make sense. The tensor fascia lata muscle attaches to the fascia lata. Next set of muscles you should try and ID are the ones that are right here, which are what? Quadriceps, right? So it's a collection of muscles, 4 of them, called the quadriceps femoris muscles, and you want to use your knowledge of anatomical location to help you determine which muscle is which. So this is the vastus medialis, because where is it? On the medial aspect of the leg. Okay? Vastus lateralis, on the lateral aspect of the leg. In between the two is a big muscle called the rectus femoris muscle, right over which bone? the femur, right? So that gives us an idea. It's the rectus femoris. Underneath that is a little tiny muscle. It's hard to see, but it is the vastus intermedius. Okay? Intermediately between the medialis and the lateralis. So those are the four that make up the quadriceps. The vastus lateralis under the fascia lata, vastus medialis under the sartorius, okay? Rectus femoris over the femur, and the vastus intermedius underneath. Okay? Next set of muscles you'll find in the deep section will be pectineus, little tiny muscle. Adductor, semimembranosus, and semitendinosus. So if I look at this, the semitendinosus is actually on the border of that fat pad. You see that there? So I cut it away from here. So semitendinosus, semimembranosus, adductor, pectineus. Vastus medialis, rectus femoris, vastus lateralis, fascia lata, tensor fascia lata muscle, sartorius, gracilis. Everybody okay with that? Okay. So the sartorius and gracilis are superficial on the medial aspect. Can I see them from this side? No. On the lateral side, we have another superficial muscle, this monstrous muscle that you see here. This whole thing is one big muscle. That's called the biceps femoris muscle. And you want to separate it away cranially from that fascia lata, caudally from the fat, and then very carefully, I'll show you, and then before I tell you how to get there, we want to make sure we don't destroy this nerve, which is the, just as a guess, what do you think? No. What nerve is in your leg? Big nerve. Sciatic nerve? So we're not going to ID this week. It'll be next week when we do nerves, so make sure we don't destroy it. So that's the sciatic nerve. So what you'll do is you'll isolate the muscle away from the cranial part, the caudal part, and then I take some tweezers, kind of get up underneath and separate out this sciatic nerve from the underside of the muscle, and then I take a pair of scissors and cut through, making sure I don't cut this nerve. Okay? I reflect it back. So once again, I can't see the gracilis and sartorius from the lateral side, right? Can I see the biceps femoris from the medial side? No. Superficial muscles? Superficial muscles. But these muscles can be seen from either side. The deeper muscles can be seen from either side. So remember that was adductor, semimembranosus, semitendinosus. So if I push up on it, adductor, semimembranosus, semitendinosus. Adductor, semimembranosus, semitendinosus. Okay? You also have a couple small muscles up here. Right cranial to the biceps femoris is a tiny little muscle called the caudofemoralis. Okay? And then if you turn the cat dorsally, all these muscles right here are the gluteal muscles. Your book specifies deep, superficial, and medial. You just need to know them as gluteal muscles. Okay? Popliteal lymph node, external anal sphincter. You guys can find that here. Okay? In the forelimb, we didn't make you learn any of the specific muscles distal to the elbow, but in the hind limb, you do have to know a couple muscles. One of them is right over the top of the tibia. There's a lot of fascia here. You're going to have to get through it, and you can see this muscle here. Cranial part of the leg, tibial muscle right over the tibia. Okay? The other muscle you need to know is this. What's this muscle? Your calf, right? It's known as the gastrocnemius. So I can see it laterally, and I can see it medially. Gastrocnemius. Okay? The gastrocnemius is attached to the hock or the tarsus via this tendon here. Because remember, tendons attach muscle to bone. So on your cat, it looks like this. Just take some tweezers or some scissors, puncture through that fascia, and just do this. And you have your common calcanean tendon, aka the Achilles tendon. Okay. The other thing you need to find is the patellar ligament. Ligaments are bone to bone, right? So you have your patella and the tibial crest, and in between it is a big ligament. So I made a cut on each side of that ligament. It's pretty shiny. You can see it underneath here. And then I just cut on each side. and I end up with the patellar ligament. Okay?
Yeah.
Patellar ligament, common calcaneal tendon, cranial tibial muscle, gastrocnemius, biceps femoris, fascia lata, tensor fascia lata, gluteal muscles, caudofemoralis, vastus lateralis, adductor, semimembranosus, semitendinosus, popliteal, lymph node. Once again, vastus lateralis, vastus medialis, rectus femoris, vastus intermedius, pectineus, adductor, semimembranosus, semitendinosus, sartorius, and gracilis. Okay? The only other muscle you need to know is along the back. So turn your cat into ventral recumbency and look for this big white layer of very thick fascia here. It's very dense. It's almost like this fascia that was between the trapezius muscles. Okay? You're going to make a cut along the ventral part of that aponeurosis of fascia. Okay? And then you're going to pull up 2 layers of very thick fascia, just like this. You see that? And then you see sets of long muscles. 1, 2, 3. Those are the muscles that are on both sides of the spine. The middle one is called the longissimus lumborum. Lumborum for the lumbar, right? We're in the lumbar region. Longissimus for the fact that it's longitudinal. And just practically, why do you think we need to know this as veterinary technicians? What do we do right here? Yeah. Intramuscular injections, right? Go right into that muscle. Limb injections. Any questions? No? Okay. So go ahead and get started, and I'll come around and help you guys if you need it.